Welcome to Part 2 of Adenovirus and North American Cervids. Dr. Jennifer Davies obtained her Doctor of Veterinary Medicine with distinction at the Western College of Veterinary Medicine in 2001. At the Western College, she completed her Master of Veterinary Science in 2003 and her senior residency in anatomic pathology in 2004. Dr. Davies became a diplomat of the American College of Veterinary Pathologists in anatomic pathology in 2004. She has extensive diagnostic experience in private practice, in provincial diagnostic laboratories, and in academia. Dr. Davies joined the University of Calgary Faculty of Veterinary Medicine in 2011 and holds a senior instructor position in the Department of Veterinary Clinical and Diagnostic Sciences and is the director of the Diagnostic Services Unit.
So thank you very much, first of all, for inviting me here today and giving me this opportunity to be part of the discussion, but also to present this interesting case I had. I'll present a case of Adenovirus Hemorrhagic Disease in a farmed elk calf from Alberta. So in late fall of 2020, and 2020 seems to be a theme of these discussions today, I received some tissues from a 6-month-old female farmed elk calf. She was from a closed herd of 190 head. The RDVM reported sudden death of 19 calves over a 2-month period, and no other age groups were affected. These animals were at pasture with hay. There hadn't been any recent changes other than they had recently switched their water source to snow. And all of the animals that died were from the same pen, and this producer had multiple other pastures with no signs of illness or death reported there. So this was the first elk calf to be post-mortemed, and the post-mortem was done in the field by the referring veterinarian. So unfortunately, I don't have any gross images to share with you today. The RDVM did describe that the calf had a poor hair coat, that her eyes were markedly sunken, consistent with dehydration. And they described that 15 to 20% of one lung lobe was dark in color. And based on the histopathology that I'll show you, I'm interpreting that as pulmonary hemorrhage. They also described that the mucosal surface of the small intestine was dark red and that the content of the intestine was red and watery as well. And again, based on histopathology, I think this represents intestinal hemorrhage. The referring veterinarian then submitted both formalin fixed and frozen tissues to UCVM's Diagnostic Services Unit for diagnosis. So while I don't have a lot of gross images, I do have a lot of microscopic images to share today. So for those of you that are pathologists, please bear with me, and you certainly feel free to ask questions at the end of this presentation. So I'm going to start with a photomicrograph of the liver because this is actually the first tissue that I looked at and the one where I made the diagnosis. And what I was drawn to was that on low power, the portal areas where the blood vessels and the bile ducts are concentrated in looked very busy or hypercellular to me. And this is, maybe I'll stop for 1 second. Can you guys see my cursor moving on the screen as well?
Intermittently. Okay. Yeah, you can, and then as soon as you stop moving, it disappears.
All right, so this is good for me to know. If I keep moving it, it will show. So this is a lumen of a portal vein, and I put an animation in to trace the outline of this vessel. And you can see that there's this abrupt discontinuation and increase in cellularity because unlike, I think, in the deer cases, in these animals, it did see inflammation of the vessel walls consistent with a vasculitis, and it wasn't present in every vessel, but it was there. Not surprisingly, the blood vessels are affected. Blood isn't moving through them probably particularly well, and the surrounding hepatocytes are dying from hypoxia as a result of that. So there was some hepatocellular necrosis indicated by the star. And then some neutrophils are being called in probably to deal with the necrotic tissue, so a bit of inflammation present. I think as a pathologist, I probably almost fell off my chair because I always get very excited when I see a viral inclusion body. And when I look closely at these vessels, I was struck by a couple of things. First of all, how plump the endothelial cells were, and they're bulging into the lumen of this blood vessel. So that's consistent with endothelial hypertrophy. And then in many of the endothelial cells, there are these 10 micron smudgy amphiphilic intranuclear inclusion bodies present. And when a pathologist sees that type of thing, we wonder about an adenovirus infection that has a tropism or affinity for the endothelial cells. For those of you who don't look at lung under the microscope every day, this is what it should look like. So these are the alveoli or air spaces. They're clear and empty. And then there's alveolar walls that are very thin to help facilitate gas exchange. This is what the lung looked like in this elk calf. The star just indicates a small airway, a bronchiole, and then both in the lumen of that bronchiole, but also in the surrounding alveoli, there's this bright red orange material, and that's all hemorrhage. So quite dramatic pulmonary hemorrhage. I think that fits with the gross description the veterinarian supplied me with. If we take a little bit closer look, so this is a high power magnification again of the lung. Now we can see each individualized red blood cell. So the free red blood cells out in the alveoli, that's the hemorrhage. This structure here is a medium-sized vein. And again, you can see the endothelial cells, very plump, bulging into the lumen of that blood vessel. And almost every one of them contains the typical intranuclear inclusion body. I found those inclusions easiest to find in this case in the larger caliber vessels, but they were certainly present at all levels of the vasculature. So in this photograph here, we're actually looking at the alveolar walls. This one's relatively thin. This one is thickened because, again, of these very plump endothelial cells with the typical intranuclear inclusion bodies. This is a low power photomicrograph of the small intestine. So unfortunately, there's some autolysis or postmortem degradation of the tissues. But for orientation, the clear part is the lumen of the intestine. And this area from here to here is the innermost aspect of the intestine, the mucosal lining. And you can see in this mucosa that there's this band that looks kind of bright red to orange. And a lot of those are congested mucosal blood vessels, but there's also extravasation or free red blood cells present within the mucosa and out in the lumen, just confirming that intestinal hemorrhage. So higher power magnification of the mucosa. A lot of these blood vessels just look congested, but there was a lesser proportion of them that had these hyaline, eosinophilic, amorphous material in the lumen, and I think that's a thrombus or a blood clot there. And it's not surprising. There's some pathological clotting here considering the overwhelming endothelial activation from the infection in this case. I had to search for them a little bit harder in the intestine, but sure enough, after some searching, I was able to find the intranuclear inclusion bodies in the mucosal blood vessels of the intestine as well. So I mapped out, I guess, my decision-making tree to inform ancillary testing in this case. So I thought I was dealing with a hemorrhagic disease in a cervid species, and there's at least 3 viruses that should come to mind. And some of these viruses are associated with inclusion bodies and some of them are not. So their presence or absence can be helpful. So this case, clearly there were endothelial intranuclear inclusion bodies present. I'd never seen a case of this disease before, but I was worried that I might be looking at a case of Adenovirus hemorrhagic disease caused by deer adenovirus or Oticoles adenovirus 1 or cervid adenovirus 1. So that was my primary suspect in this case. In the absence of intranuclear inclusion bodies, you need to consider the possibility of an orbiviral hemorrhagic disease, so blue tongue or epizootic hemorrhagic disease. I was less concerned about this mostly because at this time of year in Alberta, the chelocoides vector wouldn't have been viable still. And just because you don't have endothelial inclusion bodies, you should not exclude adenovirus hemorrhagic disease because especially in the localized and chronic forms, the inclusion bodies, or maybe also in rotten tissues, the inclusion bodies can be very difficult to find and can also be absent. So I was hampered by an international border as well, and I'm able to get fresh tissues down to UC Davis. But I did send slides to Dr. Woods for immunohistochemistry for deer adenovirus. And I also sent fresh lymph node to Guelph for blue tongue virus and EHD virus PCR. Immunohistochemistry was positive for deer adenovirus, and PCR was negative for both blue tongue and epizootic hemorrhagic disease. So thank you very much to Dr. Woods for supplying this photomicrograph. What we can see here is the red positive immunohistochemical staining for deer adenovirus, which is localized to the blood vessels of the spleen. My final diagnosis was that this was a case of pulmonary hemorrhage, intestinal hemorrhage, and I did use multisystemic vasculitis in this case. Maybe vasculopathy might be more correct if you don't see a lot of inflammation, with endothelial intranuclear inclusion bodies consistent with adenovirus hemorrhagic disease caused by deer adenovirus. About a month later, this outbreak was continuing in this herd, and I received tissues from a second calf. They now were reporting 40 calves dead, so 21% mortality in the herd. The veterinarian described very nonspecific changes, so some dehydration, and this calf was in very thin nutritional condition. You can only imagine how sad I was when I looked under the microscope to not only find no endothelial inclusions, but in fact, no lesions at all. So I don't know what the cause of death was in this particular calf. I did culture to rule out septicemia. It was negative. I did trace minerals, vitamin A and vitamin E analysis on the liver. Everything was within normal limits. And just to be on the safe side, went with immunohistochemistry, and it was negative for adenovirus in this individual, which of course always leaves you in a quandary of what am I dealing with here? Is this a case of chronic infection and I'm just having a hard time demonstrating the virus at this point, or is there something else going on in this herd? So just as a very brief discussion about the virus, of course, this virus was discovered in the early 90s as the causative agent of adenovirus hemorrhagic disease after a mortality event involving mule deer subspecies in northern and central California. There's been a recent publication by Dr. Woods where they looked at archival material as well, and were able to demonstrate that these epizootics predated 1993, with, I believe, the earliest cases occurring in the early 80s, about 1981. Since that time, this virus is now known to affect multiple cervid species in both natural and experimental infections, including black-tailed deer, mule deer, white-tailed deer, moose, and elk. And it's spread well beyond the borders, of course, of California. It's reported in multiple western US states, including Oregon, Washington, Idaho, Wyoming, Colorado, and most recently in Arizona. The virus, based on recent genomic studies, appears to be nearly identical or highly conserved between the cervid species, and it looks like it's one virus, although there's a bit of divergence from the isolates from moose and from elk. Domestic ruminants do not appear to be susceptible based on some experimental studies that have been performed. Morbidity is highest and mortality is highest in fawns and immunosuppressed individuals, very typical of adenoviruses in other species. There's, of course, an acute and a chronic form that Helen alluded to already. The acute form, much easier to diagnose. There's the hemorrhagic disease, possibly with oral ulceration as well. And we see that multisystemic vasculitis with the typical inclusion bodies. The chronic or localized form is associated with quite deep ulceration and abscess formation in the upper alimentary tract, and this can lead to emaciation of animals. And this form of the disease is much more challenging to diagnose. The inclusion bodies may not be present at all, and results with IHC and also PCR are variable and can be negative. And sorry, I missed the other star when I was talking about the US. I meant to say that there were limited reports that I could find in Canada, of course, until we see the 2020 outbreak happening in black-tailed deer in Vancouver Island and the surrounding Gulf Islands. When I looked through the literature on elk, there's not that much there. I was able to find the BC Wildlife Health Report that indicated that in archived elk serum, they had confirmed exposure in BC elk about a decade ago. There is a mortality event reported in 15 free-ranging Rocky Mountain elk calves in Colorado. They described similar clinical signs, gross lesions, and microscopic findings, as has previously been seen in deer. They described again the systemic and localized forms. They thought this was a multifactorial mortality event with contributing factors being malnutrition and sepsis. And the authors of that paper did postulate that malnutrition may have been a non-infectious stressor predisposing to adenovirus infection in these elk calves. So I think, like all good cases, this one has probably left me with more questions than answers. Given that this is a closed elk herd, I'd like to know where this virus came from. Has it been endemic in this herd and has gone unrecognized up until this point? Could it have been transmitted from local cervids wild cervids in the area? I did phone the referring veterinarian. There has been no movement of animals on this farm. There's been no movement of people from this farm, and they haven't noticed any increased mortality in the wild cervid population. I have some questions about whether there's more than one thing happening in this elk herd, given that I have another elk calf that's in poor nutritional condition and doesn't have a diagnosis to date. And I'd also like to know how this isolate is related to other deer adenoviruses in North America, but especially the BC isolates from the most recent outbreak. So to that end, Dr. Oliver Lung from NCFAD has graciously taken tissues from these two calves and will be performing the genomic analysis with, I guess, data to come in the future. That brings me to the end, and I'm happy to answer questions now or whenever Andrea sees fit.
Please join us for part 3 of Adenovirus in North American Cervids, where Dr. Leslie Willis Woods will present Adenoviral Hemorrhagic Disease of Deer in California.